Dr. Ann Borick, board certified in internal medicine and exercise physiology, chairman of Department of Medicine at Gilbert Hospital, adjunct professor at Midwestern University College of Osteopathic Medicine, black belt, and founder and host of DocTalk.
It's about caring for your health and well-being.
Taking your calls and giving you clear answers to your health questions. Information you can use for your whole mind and body wellness.
You're not going to want to go away because...
Ask Dr. Ann your questions live at Radio DocTalk on Facebook, DocTalk Radio on Twitter, or email Dr. Ann at askann@doctalkradio.com.
Welcome to DocTalk Radio. I'm Dr. Ann Borick, broadcasting from the Double Wide studio. And we have a great guest in the studio today. We're going to be focusing on acupuncture and all about it. What is it? How does it work? What are some of the diagnoses that we use? You know, I'm a board-certified internal medicine physician practicing here in Arizona as a hospitalist at Gilbert ER Hospital, which is the sponsor for this show. But we have a great guest talking about acupuncture. Jim, thank you so much for being here. Welcome.
Thank you so much, Ann. And again, thank you so much for inviting me out to the show. It's really a pleasure being here with you. Hope I can bring a little bit of information about acupuncture and the practice to your audience here.
Great. You know, tell us a little bit about yourself and your training and just really how you got into this.
Sure. It's a pretty long road since getting into this particular area. Like yourself, I actually grew up in the great state of Pennsylvania.
Okay.
Yeah, I actually lived in Philly for a few years and got tired of that weather and eventually made my way out to Arizona. Through a series of things, I really spent most of my time in medical imaging. That's really where I got my start. So that was kind of the introduction to, really healthcare, I guess, in general.
Right.
From that point, I did some work through Good Samaritan Hospital here, did some oncology work. And as I got through that whole area, I was really looking for a way to really be a bigger part of somebody's life. And I really liked the natural approach to healthcare as opposed to the high-tech version that we're normally exposed to. So the acupuncture model was really just a natural fit for me.
Wow, that's fantastic. Tell me how did you get your training and where did you train?
I did train here locally in Phoenix. There's a very good program called the Phoenix Institute of Acupuncture and Oriental Medicine. So that particular program, about a 3 to 4 year program, depending on how you get through it. Following that, you take national boards. Following that, you can get licensed in individual states. So that's really been my path through getting through this. And it's been a great experience so far, going all the way through that process.
Really great. Yeah. Now, have you ever been over to China or anything like that?
Yes. In fact, once I graduated, I did have the opportunity to do an internship in Chengdu.
Wow.
And that was a very good experience to see and to kind of experience everything that we've learned over a 3 to 4 year period, seeing it practiced on a large scale. I worked at a large university setting hospital. And in that area, multiple clinics and multiple approaches to healthcare. The way China was set up at the time, and I'm not sure if it's still the same way, it was defined as either you were choosing a traditional Chinese medicine healthcare track or a Western track.
Ah, okay.
So in the particular area that I was in, it was very, very limited to anything Western. It was all either herbal medicine or acupuncture clinics.
Boy, that must have been a great experience for you.
It really was a phenomenal experience. It was a very interesting culture, a very gregarious, noisy, shovey, full of life and energy. It was really a tremendous experience.
My goodness. You know, what is acupuncture? For most people, we hear it, we know a little bit about it. What is it?
Yeah. It's always difficult to try to explain an energetic medicine, but what I found is the easiest way to address that is to really compare models.
Okay.
And the analogy that I like best is that when we look at Western medicine primarily, that's basing the body on a biochemical model. So what's important to most physicians, I'm sure yourself included, is the physical aspects of how people are put together, lab chemistries, and based on that you come up with a diagnosis and a treatment plan. And that model works very, very well in a lot of cases.
Sure.
In the traditional Chinese medicine model, in its simplest form, it's an energetic model. And what that means is you're a ball of energy. And to make some sense out of such a vague concept, it's then broken down into meridians. And then each one of those meridians is defined as having some influence over an aspect of your physiology, your emotional state, and your energetic state. And I think that in and of itself is one of the strengths of this entire approach is that it incorporates the body as a whole, even though you might be treating one segment of it.
Interesting. Now, you said meridian.
Yeah.
Tell us what is a meridian, just for our listeners and really
Sure.
to kind of get our minds wrapped around this whole thing.
Meridians are probably the aspect that most people kind of think of when they look at an acupuncture picture. It's lines on a body with little dots on it. There are really 14 major pathways that are defined with points along those particular pathways. Each one of those pathways is then used to both diagnose and to treat particular types of patterns. That's one other important point, too, is that generally when we look at the practice of Western medicine, it's a disease-based product. You have bronchitis, you have cystitis, you have something and it's treated for that.
Sure.
In traditional Chinese medicine, it's a pattern-based analogy, and that's one of the reasons why it's as effective today and as relevant today as it was 2,500 years ago. Because you look at the patterns, and the patterns that existed 2,500 years ago still exist today. For example, people had belly aches 2,500 years ago.
Right.
They had osteoarthritis, they had back pains and things like that. So when we define those patterns, that definition is as relevant today as it was before.
Interesting.
So it's somewhat difficult to answer your question directly as far as what a meridian is. But I guess probably in the simplest sense, I can say that it's an energetic pathway, and it is a pathway that is then defined for some specific things in the body. I'll give you an example.
Right.
We talk a lot about spleen energetics in traditional Chinese medicine. And in spleen energetics, that particular pathway starts on the foot and then migrates up through the thorax. That particular pathway deals primarily with the transportation and transformation of food. So what we eat energetically then provides us with the energy that we need to live and carry on and carry out our wishes and all that particular type of thing. So when we're looking at pattern identification, we'll oftentimes look at points along that particular meridian that might tonify it or add strength to it, or maybe drain some damp away from that particular product. And I know some of those terms sound a little bit odd at first, but we'll probably talk about those a little bit later and maybe make a little bit more sense of those as well.
Do you make a diagnosis by using the needles to gather information as well as stimulate? I mean, is it, is that a right way to think about it?
No, I think that's really a very good concept. I actually make a diagnosis a lot by palpation. I think that that's really an important part. I get a lot of feedback when I press on different acupuncture points, but the feel that you get when the needle goes in is significant as well. And again, some of these terms sound odd, but there's a hollow sense that you can sometimes feel, which would then be vacuity or an emptiness.
I
see. That's one of those things that sounds a little bit odd when you speak of it, but it is really something you'll feel clinically.
Interesting. Yeah. Wow, that's really fascinating. In terms of risk factors, is there a risk factor for anybody, for example, if somebody's on blood thinners or Coumadin or anything like that?
Right.
Who would you recommend would be a high-risk patient for acupuncture? Or is there?
Really, there's really not a high-risk patient for acupuncture. There's always a concern with bleeding if somebody is on blood thinners, but it certainly isn't a contraindication in and of itself. Most of the acupuncture points that we're going to use are going to be away from major vessels. All of us are trained within the anatomy and physiology below that point that we're using as well. So usually in a worst-case scenario, we might see something with a little bit of bruising on the skin, or maybe as we take the needle out, we might even see a little bit of a bump. If we do, it's automatic pressure, just like you would do in any other scenario.
Right. Interesting, you brought up a really interesting analogy earlier. When we get blood work done, why don't you share that thought?
Sure.
Because that really drives home the thought.
Right. It's, again, I was mentioning earlier off the air that it's just one of my pet peeves that one could go in for a lab draw and get a big black and blue mark, and it's not considered anything.
Right.
And yet in traditional Chinese medicine and acupuncture, that's considered an adverse outcome.
Right.
So when we see the numbers as far as bad outcomes, that's a big part of what we're actually seeing is the adverse outcome of acupuncture.
That's interesting.
Other things that we sometimes will see is a little bit of lightheadedness after getting off the table. And that could either be because somebody is relaxed and laying down, or it could be because of the needles as well.
Okay, that's interesting. So can you take us through a step-by-step approach on what to expect? If somebody were to come to you as an acupuncturist for a visit, what can we expect?
Two different approaches on this. The approach that I really like to do is generally I set up an hour and a half of time with an initial patient coming in. They'll have some forms filled out ahead of time. And what we'll do is use that as a starting point to really go over a good history of what's happened to them in the past, what their health history is, and probably what's been significant over the last, say, 6 months to a year. Based on that, we'll make assumptions and definitions as to whether there's weakness within stomach-spleen meridians, whether there's issue with liver gallbladder, if there are pain issues, which meridian systems that's close to. And based on that, we'll come up with a pattern identification as close as we can. And then from there, a point selection that will then address that particular pattern. If we choose to use herbal therapy, we can use it in two different aspects. Number one, we could either go with something that would be complementary or something that is very similar to what we're doing from the point prescription perspective.
Right. Do you recommend that people hydrate, before coming to an acupuncture visit?
Generally, we recommend hydration just because it's the right thing to do.
Mm-hmm.
I don't think there's really that much of a relevance with acupuncture in and of itself.
Okay.
Oftentimes, we'll hear a massage therapist especially.
Exactly, and that's why I asked.
Right.
Mm-hmm.
Not as much from this model, but I always recommend the fluids simply because it's the best thing for us. Okay. We're a water species, so we need to keep that well hydrated, especially here in the desert.
Exactly. When we come back, I want to focus on conditions that you treat. I know that you talked about pain, fibromyalgia. Don't go away. We'll be right back. Welcome back to DocTalk Radio. I'm Dr. Ann Borick, and I'm here with Jim Burness, a certified acupuncturist here in the Valley. And, Jim, is it true that 3 million people today are getting acupuncture? Is that an accurate number?
I think it is a very accurate number. It's kind of hard to believe that we're actually treating that many people, but acupuncture, especially since the time that I've been involved in it over the last 13 or 14 years, has really become really mainstream. It's hard to find someone now that either hasn't seen an acupuncturist or hasn't have a friend that has seen an acupuncturist.
Exactly. It's true. And, as a hospitalist, I know that more and more acupuncturists are being welcomed into the hospital.
Exactly, right.
What is your situation? Do you currently practice in a clinical setting?
Right. I currently practice through one of the major providers, healthcare providers here in the Phoenix area. Mm-hmm. And within that group, we have a series of 5 acupuncturists throughout the valley. Wow. And that's really helped tremendously as well as far as adding a little bit of credibility to the profession and diversifying the hospital-based systems a little bit as well. So
absolutely. That's
really been a very good boom for our whole approach to healthcare.
And, it's great for the patient care.
Exactly.
Let's talk about patient care. What are some of the most common complaints that you see that you treat patients with acupuncture?
Again, that's really good too. By and large, the most common thing is pain. Mm-hmm. And that pain really can be anything from, again, headaches, migraines would be really common. Low back pain is probably one of the bread and butter points or things that we see in every practice. When I think is it 84% of all Americans will have back pain in their life. Yeah, something to that effect. Mm-hmm. So that's a very large aspect of it. The other thing that we see pretty commonly is addictions. So we'll see cigarettes, alcohol, drugs, and there are a lot of different factors that go with that. So outcomes generally are not nearly as good as they are for something like pain management, but that's still another item that we see. We'll see mild to moderate depression, anxiety, and all of those things tend to respond relatively well with this particular model because as you relax the body, or you might have an opportunity to give someone a suggestion or tools to be able to relax, you really get to make some headway in that, and oftentimes you can do it in a non-chemical format, which is the strongest point.
Boy, that's great. Give me an example. Let's say I referred a patient to quit smoking.
Sure.
How many sessions would they have to, on average, follow up with you?
Yeah. Again, there's a lot of variability. What I use is a 3-week program.
Okay.
Because the general feeling is that if you've done something for 3 weeks, it's a new habit. And so what I'll do is basically have a 0 tolerance. When you walk through the door, it means you're done with cigarettes.
That's fantastic.
And
alcohol or whatever
same thing,
it is.
Right. Mm-hmm. There was an interesting point that I found along that particular line as earlier in practice. I would try to be nice and tell people that they could wean off cigarettes. Mm-hmm. And their take-away message was the acupuncture said it was okay to smoke. Uh-huh. So going back to a 0 tolerance, I think, is really the best way to look at it.
In their best interest,
exactly.
That's the best way to
And if they
approach
fall, that's fine too. They can then get up again, but at least they walk out the door knowing that that's it. Mm-hmm. And the combination really will work very well. What I like to do, especially with addictive behavior, is try to use as many replacements and other therapies at the same time. So you look at sometimes group therapy if it's, say, alcohol related. You look at replacement behavior. So instead of lighting up a cigarette, you get your favorite glass of water. You get 5 ice cubes in it.
Right.
You have a particular type of format, and it takes you 7 minutes to drink it. Same that it would be with a cigarette. So as you begin to add those things in, as you begin to develop relaxation techniques, you get a stronger and stronger long-term effect.
Now, would that be the same for, let's say, chronic neck pain or headache or back pain, like a 3-week approach?
A 3-week approach, I use 3 weeks a lot for a couple of reasons. Not that there's any particular magic to 3 weeks, but it will give me a clear understanding of whether I'm going to be able to make an impact on somebody.
Right.
If there's no change in pain, especially after a 3-week, probably it's going to be limited. Either I'm not addressing it correctly or they're simply not going to respond to it.
You know, that's great for our listeners to hear, because a lot of times we think of, well, once you get started, you've got to commit for a year.
Right.
You know, you've got to commit forever.
Right.
And that scares people away, I think.
Exactly, right. And that's why I really try to bring that up with all the clients that I work with at first, is that I want to consistently see you once a week over a 3-week period.
Right.
We want to try to define a baseline as best we can, whether it's pain, whether it's addictive behavior, whatever it happens to be, and then see what kind of change there is after that 3-week period. If we could do a measurable change,
Right.
And I'll give you an example with pain numbers. This is really a good way of looking at it. Let's say that you walked in with back pain of 7 or 8.
Okay.
And after 3 sessions, your pain is 5. Clearly a measurable difference. You're getting better. But we would definitely continue with therapy to see if we could drop down that plateau even a little bit lower.
Right.
So we might continue with maybe another 3 weeks of therapy. And then generally after that, as opposed to just dropping someone, I'll do a 2-week follow-up, maybe a 3-week follow-up, maybe a 6-week follow-up, or something as necessary.
To keep the energy and everything kind of aligned.
Exactly, right.
Yeah.
And also addressing things as they pop up before you let them to get into a severe case again.
Exactly.
Right?
You know, chemotherapy-induced nausea, it has been a big topic in the literature, in the research. Can you talk about that?
Sure.
Is that something that is real, that responds?
Very much so, very much so. When we look at chemotherapy, we certainly look at toxins that the body is taking on.
Right.
It's usually an emotional concept or aspect of that as well. So when we do the acupuncture, we're really going to be covering a couple of both of those items. I mean, we mentioned spleen qi a little bit earlier. We'd certainly be addressing spleen qi. Sometimes, depending on whether the client is interested, we can use some herbals that would actually augment that energetic as well. And then addressing the emotional needs. One of that's, again, I know it's actually changing in a lot of our cancer clinics now, but some of them have had a reputation of being a little bit on the cold side. You know, you're getting a chemotherapy agent, you're really not getting your hand held very much. When you come into the acupuncturist office, it's a very warm setting. You're comfortable. You maybe have a heat lamp over your belly.
Right.
Somebody is talking to you and asking you about your individual case. So you really feel like you're being cared for, and that's not to suggest in any shape or form, but it's a little bit more nurturing, and I think that nurturing environment is essential to the recovery process.
It really, really is. There's no doubt about it. Is this covered by health insurance?
Many insurances are starting to cover it. Compared to where it was when I first started, we're seeing more and more organizations that will have some complement for an alternative medicine.
That's great.
Hospital healthcare systems are covering it at a pretty good basis. Unfortunately, at this point, there isn't anything with Medicare, and that's a question I get a lot from the seniors, especially out in the East Valley. There is some indication that with the Affordable Health Care Act that's coming up in 2014, that there may be some coverage. A lot of that stuff is still up in the air, and I know that we had recently had a petition out in order to get acupuncturists recognized as providers, and I believe that has gone through. So I think things are looking up pretty well for getting some form of reimbursement.
You know, and more, a lot of corporations have wellness programs.
Yes. Right.
And, you know, in and of itself, that's something that they can bring in nutritionalists, acupuncturists, massage therapists, that kind of thing.
Sure.
You know, Jim, can you share with us any interesting cases that maybe you've had? I would love to hear clinically what types of patients you manage.
In the recent past, there are really 2 cases that really did stand out to me. And the first one is a middle-aged woman. She's a 53-year-old woman, and she had an eye twitch, and that eye twitch was just really annoying and bothersome for about 3 to 4 years.
Wow.
She had to work up through one of the major hospital organizations here in the Valley. That workup defined her diagnosis as trigeminal hemiparalysis. And she also had an MRI, which indicated there might be a blood vessel that was close to the trigeminal nerve creating that problem.
Right.
So basically, she was left with 2 alternatives, and that was surgery to stabilize the vessel or high doses of Neurontin. And that's, for your listeners, that's an anti-seizure medication that's used a lot for neurologic type pain systems. So she opted not to have surgery. I'm very glad to hear that.
Right.
And she did do Neurontin for about 6 months and had very limited relief from it. As a last-ditch effort, she came into the acupuncture clinic. And I was very, very fortunate to work with her and actually resolve the issue. And actually, to this day, it's still resolved. The twitch actually went away after the second treatment.
Wow.
And really never came back. There had been a couple of hints of it with a mild twitch over that right eye, but nothing that actually manifested all the way through.
Now, when you do acupuncture, do you do it right at the location, or just kind of give me an idea? Would it be the ear, or where would the points be?
In this particular case, and this kind of brings up a little bit of meridian therapy that we were talking about earlier. Her diagnosis, or twitch in traditional Chinese medicine, is usually related to what we'd refer to as wind involvement.
Okay.
Usually the analogy I use with patients to make a little bit more sense of this is you're looking at a tree, it's not moving, and all of a sudden the leaves shake. That's wind. And tremor, Parkinson's, eye twitch, any of those would be related to that same process within traditional Chinese medicine. It's a wind invasion. It causes something to move. And her underlying pattern was a liver blood deficiency, and that deals a little bit more with tendons, muscle withering away, and spasm. So that's kind of like the underlying pathology that was in that particular case.
Interesting.
So treating both of those, and then answer your question specifically, I did points right around the eye, but when we're looking at the other underlying pattern of liver blood deficiency, there are a lot of points that I did on the leg. And that refers to the spleen channel, because the spleen channel deals with blood or the energetic aspect.
When we come back, Jim is actually going to do acupuncture on me. And so, that's why I ask, where do these needles go? So you're not going to want to miss it. Stay with us, because you're going to see me as a patient get acupuncture by Jim. We'll be right back. Welcome back to DocTalk Radio. I'm Dr. Ann Borick, and this has been a fascinating conversation about acupuncture. And in a minute, we're going to have Jim do acupuncture on me, so you'll see exactly what the needles look like, and you'll be able to see my face when he puts the needle in my hand. It's interesting. I've actually been a patient of Jim. Actually, I had some chronic neck issues, and so I'm not just letting anybody put needles in my arm. He really does a fantastic job. If you're interested, why don't you tell us your website for those interested?
Easiest contact is the website is acualt, acualt.com. And on that site, all my contact information is there, as far as faxes and emails and phone numbers and all that.
Excellent, excellent. It's interesting, Jim. My background is in the martial arts.
Yeah.
When I was probably 8 or 9 years old, I started karate, and really the whole idea of energy and the yin yang and the whole thing is very much a part of who I am. And here I am, practicing Western medicine, but the essence is really from an Eastern place.
Sure.
How does it tie in? I'm sure there's a connection.
A huge tie-in, and really the acupuncture model, traditional Chinese medicine, is really an offshoot of martial arts as well. There had to be a good way to manage those elite forces and to keep them on the field of play as long as possible.
Interesting.
So acupuncture, qigong exercises, herbal therapy were all the early developments in order to keep those warriors as strong or to heal them as quickly from injury. That's why we really have a lot of emphasis on pain management, and we do such a good job with it. I think it really dates back to the early history of the profession when you saw that applied to those particular areas.
Right. There's a lot of research, and I'm sure there's even more research to come that will unravel other benefits and indications, I think, for acupuncture in the future. I mean, as you know, more and more research is being done now in this field.
It's a little bit off the topic here, but that's really a common question that comes in. What is acupuncture good for? And really the comment is that acupuncture is a healthcare model, just like Western medicine is a healthcare model. So we really address everything. We don't address everything very well oftentimes. I mean, for example, acute injury, you would never really want to see your acupuncturist. You'd want to go to Gilbert Hospital.
Exactly.
So in a case like that, I think you try to pick and choose the best out of both those worlds.
Absolutely. Speaking of, why don't you just show us what you would do if somebody came in to get acupuncture?
Okay. Well, we'll start off with this right over here.
Okay.
A really common point, I'm going to bring you over here just a little bit if that's okay. A really common point that we use and that probably everybody is aware of, this point is called LI4. And Li4 is a really strong point for pain management. It's generally related to the front part of the head, so frontal headaches, dental pain, things along that line, but it really can be used for any type of pain.
Jim, let me stop you there.
Sure.
Is it the same side? So the left arm would be the left side, or does it matter? Would you use the right arm for the right side?
Generally, it doesn't matter.
Okay.
That's actually a really good question
Okay.
because there are some applications where we'll do the contralateral side to address something.
Okay.
But when we're looking at generally acupuncture points for the things that we talked about earlier as far as pattern identification, since the body is a mirror system, it really doesn't make a difference whether it's left or right. And there are more esoteric arguments that you can go either way, but for the most part, no.
Okay.
So what we're looking at here is called the large intestine meridian. And in addition to pain management, we have the meridian that starts right here at the beginning of the index finger, and that rotates all the way up, and then it actually comes up around the lip. And that's one of the indications of where that meridian is as to what it's going to treat.
Okay.
That's another way of looking at treatment within traditional Chinese medicine. You can treat along the line of a meridian. Let's say, for example, you had deltoid pain or you had tennis elbow.
Right, tennis,
I'm going to treat that particular meridian because that happens to be where it lies.
Okay.
But you can also look at more of a pattern identification and say that, well, no, this is a blood deficiency issue, so I need to do the blood deficiency points.
I see.
And in a lot of times, what we really do is a combination of both.
Okay.
I like to cover all my bases. So the first thing we're going to do, acupuncture is not a sterile technique. So all we're going to do is wipe the skin down with alcohol the same way if you go in for a lab draw. We're going to let that dry for just a few seconds. And the gauge on these needles is really, really very tiny. A lot of people really have phobias about this, but I don't know if anybody can see this on camera, but the gauge here is, I think these are 34 gauge, either 34 or 36. And unlike the needles that we get for a lab draw, these look just like the point of a pen.
Okay.
So they're very sharp, and they don't do a lot of tissue damage because most of it is pushed away.
And obviously they're sterile,
Yeah,
they've
exactly.
never been used before and all of that.
There you go.
That's
I did
good
bring
to know.
clean ones in for you. Yes,
That's
yes,
good.
absolutely. The other thing that a lot of us will use are a little tube. And the tube is pressed against the skin, and it makes that skin like a trampoline so that I
that's
can really
interesting.
push that through very easily. And what I'm going to do is just advance a small amount. And basically that point is in place.
You know, I can't even feel that.
Yeah, in most cases, and again, that's generally how it is. Just like with anything else, there are points on the body that are more sensitive than others. There are a lot, especially when we're doing abdomen points, that people really don't feel at all.
Right, right.
So
That's really amazing.
in this particular case, this is, again, a well-used point. It's the terminology in Chinese medicine is that it's a command point. So it has influence over the top of the body, the head specifically.
Now, for a treatment, how many needles would you use at one time? I mean, this isn't all you would do.
Oh, correct, right. Generally, we're going to do them in combinations, and within normal range, let's say somewhere between a low of 10 and a high of 20.
Okay.
Generally, with pain management, I'm going to use a higher number because I'm looking at both where the meridians lie, and then I'm also going to treat the underlying factors as much as I can identify them. If I'm looking at a pure pattern identification, chances are I'd be using less points because I'm just going to address the pattern.
Interesting.
Yeah. Going back to what we talked about earlier with the liver blood deficiency and the eye twitch, I did a lot of points in that case because I'm doing local points around the eye, but then I'm also doing a series of points for the pattern. If there was no twitch, the number of points would be cut in half.
That's, you know, now is there, sometimes you connect it to a stimulator.
Sure.
Tell me about that.
Sure.
How,
That's actually a question that comes up a lot, too, is like 2,500 years ago. Do you want me to take that out?
you know, it's fascinating because I'm not, it feels a little full kind of, because I'm real in tune with energy and chi.
Yeah.
This side feels a little bit different than this side.
Yeah, and that's a common complaint.
It's not a
common
complaint.
state, right? Exactly.
Yeah, it's a state.
There is a sense that you can feel something there, an emotion and an energetic. And as acupuncturists, I think that's really what we get tuned into, or at least some of us do. I get a lot of feedback from the needles when we were talking about that earlier. That's the kind of information you're looking for.
How long do you leave that in?
Generally about 30 minutes.
Oh, wow. Okay.
Yeah,
All right.
That's pretty much a standard. Let me get that out of
Yeah,
the way,
so we
and
can
we'll
take
talk
it
a
out.
little bit about the electrostim. And you can see in
That's
this particular
amazing.
case, we have one tiny little drop of blood. And what I'm going to do is just hold a little bit of pressure there. You're not on any anticoagulants,
Nope,
right?
nope,
Okay,
we're good. I
very
can
good.
hold that.
Okay, good.
That's fascinating. So, yeah, I guess the question is, when do you connect it to an electrode and the indications?
Sure. First of all, the question I was going to mention, or I was going to make a comment on that earlier, is people will always say, well, they didn't have electrostim units 2,500 years ago.
Right.
But there are techniques that we use that are twisting the needle and thrusting it in. You can think of it the terms that we would use is tonification or sedation. If we want to sedate, what we're going to do is unscrew the needle. And so you're going to insert and unscrew, so you're letting energy out of that pathway.
Oh,
if you want to try to tonify it, it's just the opposite. It's almost as if you're pushing energy into that point. So when we use the combination of electrostim, that's the tie-in, is low frequency that would be, say, somewhere between maybe 2 and 8 hertz would be considered tonification, adding energy to the point. And if we use the higher frequency, it would be considered sedating. So a lot of times when we're doing pain management, and in pain management, I tend to use electrostim a lot because we want to get as much activity and we want to sedate that energetic as much as possible. And the other thing is I'll tend to actually use a combination of both because the lower frequencies will tend to make the muscle twitch and you'll actually fatigue it. I'm sure you remember the old frog leg. You twitch it, and eventually there's nothing left.
Right.
And that's what we want to do, too, is fatigue it. So we're going to use a little bit of concept of Western medicine in there in addition to the traditional Chinese medicine acupuncture.
That's amazing. You know,
because trigger point therapy would be very similar.
That would be my next question. Is there anything that you can recommend our viewers, or in terms of acupressure?
Sure.
If you have a headache, is this something good to do?
That's actually very, very good to do.
Okay.
Right there. The other point that's a little bit
right in the web between the thumb and the index finger.
And when you press that, that acupuncture point happens to be very large. If we use let's say a sizing on it, that acupuncture point is probably 1 centimeter in diameter.
Oh, wow.
Whereas some are going to be very tiny. So when you press on that, you're really going to get a sensation of it. So that's a very easy point to hit. As far as other ones, oftentimes we have to be a little bit more focused as far as the needle position and placement.
Okay. Right. So that's interesting. Headache. This would be
headache
the thing
right
to do.
there is very good. The other point I was going to mention is ears are actually very relaxing. So although it might seem unusual, if you roll the ear, oftentimes that will relax somebody that's upset or irritated or anxious. Those can be used. The equivalent point right here between your great toe and your second toe is a very good point for anxiety and stress as well.
Oh, wow.
It's commonly used for that. So if you're in a position where you could put acupressure on that area, that would be another important one. And finally, one other point that is probably the second most common point to this one right over here is stomach 36. And that's on the outside aspect of the leg on the tibia. And it's considered a longevity point within traditional Chinese medicine.
Really, really fascinating. This has been great. I really want to thank you for doing this. We're going to be talking about nutrition. And before we take a break, is there anything that you would recommend in terms of supplements, herbal supplements, before we talk about food, that you would connect with the treatment of acupuncture?
Oftentimes
like calcium or anything like that stand out.
The standouts that I really see, there's certainly tonic formulas that I use for kidney energetics primarily. But one of the things I really use consistently with a lot of patients in the winter season is astragalus and Siberian ginseng. Both of those are considered adaptogens. Both of those will augment the immune system. So it doesn't make you immune to the colds or flus, but it does support those energetics. So I personally use those, and I really get a lot of my patients to use those. If somebody actually has an underlying deficiency, I'll use a more complete formula. But over the counter, that's readily available to virtually everyone.
Say that again. What is it?
It's astragalus and Siberian ginseng.
And Siberian ginseng.
Right.
When we come back, we're going to focus on foods. Food Facts is a segment that we always do on the DocTalk show. We're going to be focusing on dairy. So don't go away. There's a lot of good information, both pro and con, in terms of dairy. We'll be right back. Welcome back to DocTalk Radio. This is the Food Facts segment, and it's intended really to bring health information pertaining to the human body as it relates to food. And historically, when we talk about different foods, we oftentimes refer to the health benefit to the body. Today, I want to focus on something that may not necessarily be healthy for the body. And it'll be interesting to hear Jim Burness's view on that. Jim is a guest on the show, a certified acupuncturist. And I know that dairy products, from a Chinese medicine perspective, is really kind of questionable. Can you shed some light on that for us?
Very much. I probably the dairy lobby is always going to cringe when they hear an acupuncturist is going to be talking about dairy because it's really downplayed a lot within traditional Chinese medicine.
Right.
When we look at at foods in general within traditional Chinese medicine, we don't really look at carbohydrate, fat, or protein content. We look at whether they're damp producing, whether they're hot producing, cold producing, or drying. And a good example would be a hot pepper. Clearly, that's a hot energetic. If we look at something like peppermint, that's going to have cool energy. We look at watermelon, it's going to be moisture producing. Right. So when we look at dairy as a whole, and milk certainly stands out with that as well, what we really see is a food that's damp producing, and it gums up the works, so to speak. There's an analogy that I use with patients routinely, and that is to think of your GI system as a campfire.
Okay.
Mm-hmm. So if you have a little kindling campfire, what you do is you put tiny little sticks on it, and you build it up until that fire becomes a raging fire. Mm-hmm. If we look at foods within traditional Chinese medicine, and we look at putting dairy onto that tiny little campfire, what we're actually doing is putting it out, because you're putting something very cold and damp within that fire that is not really supporting it. It's going to actually be negative to it. Now, for people that have rip-roaring GI systems, it really doesn't make a difference what you do. They're going to be tolerant of anything.
Right.
But generally speaking, that's the approach that we would take. So in traditional Chinese medicine, with a lot of GI issues, certainly with aspects of arthritis, osteoarthritis specifically, we really try to steer people away from that product, at least for a period of time, to see if it's going to have an influence on them.
So ice water probably is not the best thing.
Exactly. Ice water would be really somewhat negative by TCM standards, because you'd want to stay more neutral with room temperature.
So room temperature. Okay.
Exactly.
So everything in moderation. You know,
Right.
that really does make sense. I know in my practice, when I have patients who have allergies, asthma, even sinus problems, a lot of times we say, avoid milk, avoid dairy products, because it tends to increase phlegm and mucus.
Right.
From a Chinese medicine perspective,
exactly
is that
the same
accurate?
thing, right? Very much so, and that's really the pattern recognition. It would be cold, damp, or damp phlegm accumulation, things like that. Okay. One of the things that we can see really pretty readily is, especially with children, if they have even a mild allergic reaction with milk, they'll get real mucusy and phlegmy
Colicky.
And everything. Exactly, all that from the dairy product. And I think that same thing happens in us as adults, except we've been getting used to that particular process. One of the things that's really nice to do is you get someone away from those products for about a month to 6 weeks, and then have them reintroduce it. And in many cases, what they'll do is feel really poor when it's reintroduced.
Interesting.
Yeah. But what they've gotten adjusted to is during that time of constant use, they just...
Right. You don't know how bad you feel until you do that. Lactose intolerance is a big, big deal. We see a lot of people and a lot of patients with lactose intolerance. And again, that fits right in line with milk. Yeah. I know for me personally, and even recommended in my patients, any more organic milk and dairy products is really the only way to go, just because of what is found in it. Right. There's some studies that I just want to share with you. Sure. There's so much in terms of the recommended balanced diet, and I'm not sure that it's really that accurate. For example, there's some studies out now. We've been taught time and time again that milk helps to prevent fractures and osteoarthritis. There's absolutely no studies confirming that. Right. In fact, there was a study where, according to the Nurses' Health Study, dairy may actually increase the risk of fractures by 50%. A lot of people are thinking that they're taking milk, they're getting calcium, and that is really not the case. It is not necessarily good, and nor does it really prevent osteoporosis from a Western standpoint. Right. In Chinese medicine, I don't know if you want to add to that, or if there's any references that you know off the top of your head. It's full of saturated fats, correct? Right. And that's not good from a cardiovascular standpoint either. And in 75% of people, it actually causes digestive issues and problems. That's really the major thing that we see from the TCM model, is that we'll see digestive issues with it. We'll see worsening of sinusitis, allergies, anything along that particular line. So again, definitely downplayed. One of the things that I did find interesting, I was reading somewhere, and it was looking at the osteoporosis deals more with the sugar and the high meat content of the Western diet, which means that it's an acidic diet. Interesting. So what happens is we tend to use the skeleton to leach calcium out to neutralize the acidic diet. So I don't know if you've run across that, but it's an interesting little fact that interesting study that I saw along that line. So it really has very little to do with eating extra calcium or getting calcium from milk or fortified orange juice or anything else. It really has to do more with the diet. And that's true. And I think more and more research is going to validate that. That's why, on the DocTalk show, we have this segment, the food fact segment, because there's so much that we don't know about, fruits and vegetables, and more, I would like to take the approach that food is medicine. To really prescribe, berries that are good, and I mean, there's just a whole host of things that we're going to be covering on the show. And I want to just take this time for those listening that, I would love to hear from you. Email me, askann@doctalkradio.com if you have something specific that you want us to address on the show. If you have questions, I would love to hear, your comments, your questions. We'll address them live on the show, in the future. So it's really a great opportunity, to do that. Jim, in general, what can you give us in terms of, from an acupuncturist, Chinese medicine, in general, in terms of nutrition?
In terms of nutrition, and I think this probably is equal in both fields, we want a balanced, healthy, natural diet. We want to have products that are real. We want to keep them from being heavily manufactured or processed.
Right.
And if we use the TCM model, what we want to do is to make sure that we balance all of the different flavors that are there, the sweet, salty, sour, etc., bitter. And we also want to make sure that we're balancing the nutritional, or I shouldn't say the nutritional content, the energetic qualities. We don't want to always stick with cold foods. And I'll give you one example with that. What we see in our population a lot would be referred to as spleen qi deficiency. And what that means is that it's just the middle doesn't function that well. If we see people eating nothing but dairy, cold salads, and maybe raw foods, that is really going to be somewhat negative to that particular condition, because you're adding more cold and you're asking that weak system to do more work. What we would do in a case like that relative to this model of medicine would be to try to warm up the diet, make sure those vegetables are steamed a little bit, get away from the dairy once again for a period of time. And if you are going to have salads, make sure that you put things in like bell peppers, pepperoncinis, anything like that to go ahead and balance it. And when you look at the energetics of foods, if you start putting in something even like black beans or a little bit of garlic or a little bit of onion, those are going to be warming by nature and make that more of a neutral meal.
It's a totally different mindset. It's a totally different way to approach it, but it really makes sense. When you mention steaming vegetables, a lot of people think that in order to get the maximum nutrition from a lot of, vegetables is to eat it in the raw form. I can tell you that that's not necessarily true. In fact, carrots, let's take carrots for example, the nutrition, the bioavailability to the body is really better if you steam it gently or if you cook it, because it breaks down that wall.
And the same thing is true with tomatoes, isn't it?
Same
the lycopene is only good when it's prepared?
Exactly. And, another thing with lycopene that is kind of interesting that I found from a reference standpoint is that when you add olive oil or, like a polyunsaturated fat to it, it actually brings out and makes the lycopene more available in the body. So there's those mixing that we really don't know a whole lot about. But, when you look at how people, in Italy eat, and their risk of heart disease is very, very low. It makes sense.
There was something I'd heard that's along that particular line, which is somewhat interesting, and that is that the United States doesn't really have a diet. Whereas when you're from Italy, you have an Italian diet.
Right.
And
The
you're in
Mediterranean.
Mexico, exactly.
Yes.
So the culture has developed a diet that works for them. And here, since we have everything, we really have nothing specific to the U.S. What is the U.S. diet? Well, it's German food, it's Mexican food, it's Italian food.
Right. Chinese food.
Exactly.
Yeah.
Correct.
Yeah.
Right. Whereas a lot of like beans and rice, for example, complete proteins when you put those together.
That's really an interesting thought. And I can just, my mind is just, there's so many different ideas and concepts that, for example, red meat is really not that good for the body. And more now we know that red meat is not good for people that have diverticulosis. It weakens the inner lining of the wall structurally. So those kinds of things to put in with your idea of Chinese medicine, I think would really make it a whole approach.
I love the idea of really combining both systems, because I think to ignore the science of Western medicine and nutrition and the components that are within the food is just as ridiculous as to not even consider the energetic qualities.
Absolutely.
The combination is really the strongest thing.
And even one more point is really what the food looks like. And I don't know if you've ever heard of or read about picture-perfect food. For example, the way that a food looks impacts that part of the body. I'll give you an example.
Oh.
And I'm going to do kind of a series on this at some point because there's so many positive effects. For example, if you cut a blueberry in half and you look at it on, cross-section, and you take an MRI of the brain, it looks exactly the same.
Really?
And we know that reference-wise from research that blueberries are very, very good for brain, you know, for the brain function. If you look at a whole sweet potato, the way that a sweet potato is actually formed, it looks just like the pancreas, the anatomical structure of the pancreas. And, you know, there's references showing that sweet potatoes are very, very good for helping to prevent pancreatic cancer and those kinds of things.
Right.
You know, so there's a lot of different, you know, connections when it comes to food and the energy quality of it, the structure quality of it, mixing them together in terms of making it more bioavailable in the body.
Right.
You know, really, really fascinating stuff. You know, before we close, is there anything that you want to just kind of recap in terms of dairy or your experience in as an acupuncture Chinese medicine specialist?
Maybe not as much recapping, but just really kind of summing up the type of medicine that this is. It's really all-inclusive. So as opposed to someone coming in for back pain or something like that, when you have an individual that you're working with for an hour, we get an opportunity to look at the influence of diet that they're doing, how much stress there's in their life, is there exercise, is there weight management issues. So it's really that full circle, and that's where I think the strength of traditional Chinese medicine is that it's always looking at the full individual relative to the ailment that you're presenting with.
You know, DocTalk Radio is really not about healthcare reform. It's really about caring for your health and well-being. Obviously, Jim, thank you so much for being here as a guest. We have many, many specialists, you know, scheduled to be on our show. Check out the website, doctalkradio.com. There's a calendar of events, and you can see all the different specialists that are going to be on the show. Until next week, I wish you health, wellness, and many blessings.